What's going on, everybody? John Stamper from John Stamper Media, and I am very excited for this first episode of Alta AI's Voices of the Future AI in Dentistry learning series. You are definitely going to learn more about the exciting work that Alta AI is doing in the dental space. However, it was super important to the Alta AI team, which really is this band of brothers and sisters who have been doing a lot of things in dentistry in the technology space that want to take dentistry to the next level, especially in AI, and especially as you're going to kind of learn in the perio side with many more things to come. But it is an absolute honor and pleasure, this first guest for me to be with. I have known of her for many years. I've actually sat in a lot of her trainings and all of that. So I really couldn't think of a better guest to kind of kick this thing off. And it's very nice to be with Wendy Briggs, who is the president and co-founder of the Team Training Institute. She's a dental hygienist, and quite honestly, she's just a pretty good human. So Wendy, how you doing? It's good to be with you again.
I'm doing amazing. So good to see you, John, and good to be here. I love this topic. It's going to be great.
All right, so we are going to get into some of the specifics along the way of this learning series of the technologies and that, but we thought where we would start off, Wendy, would be just, having you share as a hygienist, kind of this future of AI and where it's going, because I think for as much excitement as there also, when it comes to new technologies like that, there's a lot of unknowns. There's a lot of talk about it, but it certainly is not going away. So I thought that might be a good place for us to start, is just from your perspective with a lot of the work that you do. I know recently you actually had the opportunity at Thrive Live to have a presentation on the main stage to kind of talk about the future of healthcare and prevention and all of that. So let's start there.
Yeah, I'm excited to talk about this. AI is getting a lot of buzz in dentistry, but also just in the community and the world at large as this technology is advancing. And I think those of us that have, lived our entire lives at the forefront of prevention, looking at what's coming down the pipeline for the future. We've been talking about AI for more than 5 years now at the Team Training Institute because of the advantages it can bring to us, even in dentistry, even in a solo private practice, or certainly in larger groups. The impact can be bigger, but the reality is AI is here, and there's a lot of really awesome advantages for providers and patients alike when they're willing to embrace it.
Mm-hmm. And then I want to talk a little bit about kind of hygienists in general, right? And just specifically more along the lines of them being excited about it, but then also kind of the desire to want to utilize the tools in the practice, kind of the learning curves on it, at least kind of what you're seeing. And like, what is that gap from the hygienists that are just learning and kind of building their confidence and how they would use it? And then of course, integrating that with the actual tools that are out there.
Yeah, that's a great question. Really a great point too, John, because sometimes I find it's very natural for hygienists to have a little bit of fatigue. Let's just be real for a minute. Sometimes doctors will go to these conferences, these meetings, and they'll come back with what we've called, the bright, shiny object of today. And sometimes as a clinician, especially as a hygienist, when we look at all of the things that we're already asked to do in a very limited amount of time, in fact, to be honest, in some practices, that amount of time that we're allowed to do all these very important tasks has actually been diminishing over recent years. So it's not uncommon to actually have a little bit of fatigue with like, oh gosh, this is the next new thing. How am I going to find the time, the energy, and really the desire to embrace it and utilize it to the fullest extent? And so we understand if that's the general feeling at first when it comes to AI. But what we have found is that overall, once hygienists really understand the impact and the fact that a lot of the AI tools that we're bringing to them actually save them time, then the excitement tends to grow a little bit. So the hygienists that we see, they're actually embracing it and utilizing a variety of AI resources in their practices now, often really learn to appreciate it. Now, with any new thing, there's always a learning curve, right? And an implementation struggle at first. Where is it going to fit in the workflow? How are we going to do it? When we first learn to use the new tools, we're slower. And the skill sets, timeliness really comes over repetition and time. And so hopefully we're not giving up too soon, but I can tell you that what we've seen from many, many different practices and providers that have actually embraced and utilizing AI at a high level, we're seeing more benefit than frustration, right? So once we overcome that initial fear or fatigue with implementation. We're hearing about all the wins and the positive things that we're seeing in practices.
All right, so let's talk a little bit about the tech-ish part of AI, right? And the human experience. And as you know so well, Wendy, I mean, you have worked with thousands, probably if not tens of thousands of hygienists over the years in your career. And one of the things that I know is that when I think about the dental hygienist in the practice, they are so driven and focused on human care and disease and all of that, and really kind of helping the patients. And so, talk about what you've seen in regards to, learning about this tech, and maybe some of their concerns on does the tech kind of, get things mixed up with the human experience, and how you're kind of seeing that kind of move forward as we do move into the space, which, like you mentioned, is not going away, and ultimately, can be a great thing.
Yeah, I think that's a great question, John. And what we're seeing from the technology side is really an enhancement to our own human skills, right? So, for example, AI in radiographs. Initially, we're like, oh gosh, it's another software. It takes more clicks to actually see what the AI wants to show us when it comes to radiographs in patients. But then I started to hear, well, now it's actually FDA cleared to assess bone levels and bone loss and calculus detection and all these things that I thought, oh gosh, this can be a game changer, because for so long we've been relying primarily on only human beings and professional judgment and provider judgment. And this is one area that's a very common area of frustration, is we don't have a way to really create consistency amongst diagnostic skills with providers, whether that's hygienist to hygienist or doctor to hygienist. It's been a pain point in many practices. In fact, I just read a post just the other day on a social media group where a hygienist is saying, okay, here's the situation. We have a new hygienist who isn't aligned and calibrated with the rest of the hygiene team on diagnosis of perio. We think this new provider is overly aggressive and it's creating conflict. AI helps us solve that. So here we have, a way to almost introduce a third-party expert, a second opinion, if you will, that only bases their recommendations based on hard data, no emotional involvement there. And then that leaves a space for us as the human being providers to use our professional judgment or provider judgment and use the emotional involvement as we are able to then take the findings and relate it to the patient in a way that they can accept and understand and appreciate. So I think, I heard an interesting quote the other day. It says, AI isn't coming to take your job. And certainly in dentistry, that's never going to be possible as far as I know. But someone using AI is coming to take your job. And the quote really goes on to say, the first thing everyone should do is learn to use AI so they can augment their own productivity. And that's what I'm seeing in dentistry. The providers that are using AI to their fullest extent are augmenting their own productivity. And what that means in dentistry, productivity isn't the reason why we do something, but productivity is really how we measure how well we're caring for patients. So we are seeing those who are using AI really see the value in the augmentation of their own productivity, simply because now we have a mechanism that allows us to introduce consistency amongst providers, consistency amongst practices, even, multiple locations under the same umbrella. Creating a consistent standard of care has long been a struggle, but now we have some resources of technology that can really aid us in that effort.
Wendy, as I was kind of preparing for this conversation, I was going back on some prior conversations I've had just in the last couple of months. And there's been this universal theme with many clinicians that I'm speaking with, that patients, in a lot of cases, are coming into practices and they're making decisions on the practices that they go to and the practices that they stay in, where the practice is making the investment in a lot of these newer technologies, right? And so I'm curious, I want to kind of shift a little bit, to where you are seeing things along the patient side, because as you know so well, it's not that patients haven't always asked. I just feel like it's, especially since COVID, Wendy, it's been more than I've heard in a long time, right? And I don't know if it's just because in our own lives outside of the dental practice, there are so many different technologies that we use and we come in contact with in different businesses where we're starting to use these. And now all of a sudden, it feels like there's a little bit of this expectation that, okay, when I go to see my dental team, that they also are going to have some of these. So what are your thoughts on that? And how do you feel about that? And more importantly, from the hygienist perspective, how can a hygienist leverage that? And like you mentioned, continue to do even more care, which I know is what drives them.
Yeah. It's a great question. And again, it's something we see a lot of. And I agree. We've talked about the importance of technology for our patient experience course for more than 10 years now. And I think there's an expectation of patients that we are cutting edge, that we are at the forefront because we are involved in medicine, right? Anything in medicine, a lot of places in medicine are harnessing technology. And the patients see the adoption of these technologies. They see more seamless procedures. They see, for example, on the surgical side, knee replacements or hip replacements used to take months and months to recover. And now because of the adaptation of technologies as a part of the actual surgery procedures, for example, we see dentists using a Yomi robot in implant placement. That's an example of technology that can make things so much easier on patients. So we've seen for a long time, the patient has an expectation of technology, and we've seen clinicians making an effort to involve the patient in the technology. I heard a stand-up comedian the other day that I thought was hilarious, and I'm like, we're going to use that. But he was sharing with him an experience where his dentist tried to show him the x-ray. And he's looking at this x-ray and saying, I don't know what I'm looking at. They could be showing me the x-ray of my luggage scan at the airport, right, and I wouldn't know. Excuse me. So, here we have the ability to utilize AI tools, as we just talked about with radiographs. They're not going to be able to see the calculus that we can see. They're not going to be able to see the decay that we can see because we have a trained eye, but they can actually follow the red line or a red dot and see that that's actually highlighting a problem. So I think, helping patients understand and making things visual has always been something that we strive to do in dentistry, and it's something that we teach and spend a lot of time on from a systems standpoint with the Team Training Institute and the practices that we work with. Helping the patients see things as we see them has always been a tremendous driver of case acceptance. And now I think AI has simplified that for us and enabled the patients to see that. They're also just impressed in general. And when we say we've got artificial intelligence and we're using them in these ways in the practice. Back in the day, it used to be a same-day crown was like mind-blowing technology. And now I think in many cases, patients have an expectation of that. They don't want to wear a temporary. They don't want to have to come back for a second appointment a few weeks later. If they know it can all be done in one day, that's driving patients to actually change practices because they want a higher level of technology. So in order to protect ourselves from that churn of patients, we really should be evaluating how well are we using technology, AI being a part of that. But not just that, what do our patients know about it? Are we sharing that with our patients? Are we educating them? Are we inspiring them? Are we bringing them along as we utilize this technology to the best of our ability? Because that's going to have an impact on patient retention, which ultimately then has a tremendous impact on practice profitability and growth.
So as someone who has been in the industry for 20 plus years, I've been on the peripheral, not a clinician. I've spent my time in hundreds of dental practices and kind of seen all parts of the industry. And one of the things that's always been very challenging for me to watch, quite honestly, is, somebody like yourself that has spent a good portion of your career training dental teams on, their conviction and moving patients from where they are to getting their treatment done and case acceptance, right? I mean, tens of thousands of hours, as you know so well, Wendy, have been spent on that. And I know that a big reason for that and the foundation of that has been trust. And what gets me excited, and I love what you just shared, is that, when we talk about these patients getting excited about it, isn't that where a lot of this is going to come into play, right? In other words, like when you look at some of these tools, like it's going to instill that trust in the patient that whatever has been said by the clinical team, which is right so often, right? It's just been one of those challenging things to move patients through. I kind of equate a dental practice over the years. It's been an analogy that I've used where people will kind of tend to chuckle of like getting your car work done, right? Like if you don't know and understand your engine, when you go to get that work done and the technician comes to you and tells you that you need A, B, and C, and you're going in your head, that's going to be $287 and like, this is insane. It's the same thing in a dental practice, right? Like if you don't know and understand what's going on, you can't see it. Like that trust has been, there's been has had to been done by individuals like yourself and others. So that's a big piece of this, right? I mean, as patients are going to be able to kind of see that, and like you mentioned, bring them along. I think that's what's really exciting.
Yeah, and I agree. I've personally been texted photos by my own mechanic of what he saw that was wrong in my car, and I'm like, I have no context. I don't know what it's
what do you say?
It's completely unhelpful for me. So in a way, we do the same thing in dentistry.
Yeah.
And that's what I love about adding some of this technology is now we have a way, when we explain it the right way to patients and we say, hey, we use artificial intelligence as a tool that runs alongside our x-rays to highlight anything that we may need to focus on. And when patients see that, in years gone by, they'd have to leave our office and go get a second opinion. Well, in today's world, if we leverage this technology appropriately, in a way, we're providing them our opinion, but also backing up that opinion with technology.
Right.
Essentially, a second opinion is actually being given to us by the technology that we've invested in. Everything changes. Like you said, it really does facilitate the development of trust in the relationship. And for years and years and years, back in the day when all we really had was a diagnodent or a cavity detecting laser, we use that to embody trust, because otherwise it's just a doctor saying you've got 6 cavities. And there has to be an element of trust there. Well, if I can actually prove they have 6 cavities because the laser is alerting on those teeth, that helps facilitate trust in the relationship. And, again, technology, there's so many different ways we can do that. It's not just limited to AI, but AI is a powerful mechanism by which we can provide that instantaneous second opinion for patients. And it just facilitates trust in the relationship. And I know, here's the thing, I know a lot of longtime providers say, well, my patients do what I say anyway. They already trust me. And that's probably true for your longtime patients. But for some of us, it took years to get there.
Right. Right.
This is a way that we can use technology to facilitate that development of trust, even with new patients. As our practice grows or we're adding additional providers, sometimes they don't have the same level of trust in your new associate that they may have in the long time, senior doctors. Well, AI is a way that we can help embody and develop that trust on a faster pace with new hygienists or new associates in a practice. So there's just so many different advantages that we see.
Yeah, such good insight. All right, so I want to talk a little bit about Alta AI. I want to kind of get your thoughts on when you first heard about it. We're kind of brought into the to knowing that of kind of where they were going and all of that. Like, what were your initial thoughts? And again, like as someone who's known you for many years, you've always embraced and been excited about some of these newer technologies. So I'm really curious, kind of like what your thoughts were as this all was coming together.
Well, yeah, I mean, the first thing I heard was, oh gosh, this is exciting, but I really hope it works, because over the years we've tried so many different, voice activated probing. I'm not going to throw any one company under the bus, but there's been a variety of iterations that really haven't measured up to what we had hoped. I know there's been really talented and innovative hygienists over the years that have tried to develop like foot pedals and things like that just to simplify the entire process of probing without needing to call an assistant every time. And frankly, nothing's worked well. So that's one of the reasons why when they first reached out, the leaders that were getting Alta AI ready to go and asked for my opinion, I was delighted to give it, because, it does fix a pretty big problem in dentistry. And we could talk about what that problem is, but I'm sure every hygienist and every dentist listening to this understands that, often when we look at in practices, the reason why probing doesn't happen sometimes is because we don't have enough time or resources. And one of those resources is often an assistant to chart. There's some hygiene providers that have gotten really, really good at doing it by themselves, but then we lose something. We lose the verbal element. We lose part of the education and case acceptance process that we teach. So I was really hopeful when I heard about it. And when I saw the first demo and they asked for my insights, and I was able to provide some suggestions and some small tweaks, and then we had some of our members actually participate in the beta test, I got even more excited. So where they are today, where it is now, is really impressive. But I can tell you this, it does solve a pretty significant need that we've had for as long as I've been practicing in hygiene. So more than 30 years now, which is almost a little bit embarrassing to say out loud. But for a long, long time, it's been a need. And this is, in my mind, the best solution by far that we've had for this issue.
Yeah, the other thing too, I think what's exciting about AI, and this got me thinking kind of when you were talking about just the patience and the evolution of a lot of this technology, is that it's going to continue to get better. Right. So when I think about a lot of the technologies that have been brought to dentistry, like you mentioned, like was it the Agnacat and things like that, I mean, at the time, like those were obviously kind of, big deals and rightfully so. But when you think about the nature, just the foundational pieces of AI, and as each practice uses it, and all of that, how it's going to continue to get smarter, it's going to continue to feed information back to practices and the industry as a whole. I think that's what's really exciting about this, and I think that's why the Alta AI team was really excited about getting this learning series started, because this is about bringing together those that are in dentistry that want to move the industry forward and just having conversations about where it is now, but where it's going to go. And I think more so than ever, Wendy, I feel like, as you mentioned, them coming to you, them valuing, your opinion and your insight. That's what's exciting about a lot of the software on the AI side, is that you can get people involved, you can get feedback and feel like you're making an impact on some of these technologies, like you mentioned, that have needed to be here for many years.
Yeah. And that was the most exciting thing to me, is how responsive they made it. As a hygienist, and all the hygienists listening can probably agree that nothing ever goes exactly the same way. And so being able to have the AI feature within Alta AI that is responsive, where I can say, skip to this area, and then it goes right back to where you were. I just think it's very, very user friendly. And I can tell you this, John, we actually, every year at our annual summit, we often have a big idea contest. And the last couple of years, we've had a partner big idea contest. So some of the companies that are bringing innovative solutions to the marketplace, we invite them to come up on stage and, like our members, participate in a big idea contest. And they're sharing what their idea is and how they think it's going to change dentistry. And we had 7 companies participate in this year's contest, and Alta AI took home the trophy, because our members also felt like this bridged a really critical gap in dentistry, and they were impressed with how it stands today, how intuitive it is, and all of the advantages that it brings, as well as, they're, I guess, continuing to solve problems, right? So now Alta AI does not only the voice activated perio charting in a very, very effective way, but now they've even given us, afterwards, the periodontal index and some other resources. They're looking at chart notes and patient notes right now. All of these things that are really exciting to me as a clinician, because, like we said, anybody that brings us an innovative solution, we certainly want to know about it. And we'd certainly love to tell our members and the practices that we work with about it, because that's part of our responsibility, is to provide them resources and certainly services or companies that are going to help provide a higher level of impact day to day and minimize some of their frustration. And we believe, Alta does that. And certainly our members agree too, because they're the ones that vote on the company that wins. So that just goes to show, how mainstream dentistry is receiving this technology. And there's so much opportunities for continued growth, as you mentioned.
Yeah, super exciting. As we wrap, kind of in the theme of Voices of Dentistry of this learning series, which we're really excited about. You have been such a trusted name in dental hygiene. You've been somebody that so many people in the industry have looked up to. What are you excited about? Now, I recognize, like, you and I both know, like, every industry has its challenges and the like, or what have you. And certainly, there are some things going on in the world of dentistry, that are not easy and are challenges that, as a whole, I feel like the industry is hopefully working together to kind of move forward for a profession that we love. But what are you excited about when as we kind of bring this all home? Yes, we're talking specifically about AI and the technologies, but what does this mean? And when you look out over the next couple of years, what are you most excited about?
Well, certainly, I mean, hopefully the listeners have gotten a little piece of my excitement about how much easier voice perio charting is with Alta AI. That's one big thing. I think for me, what gets my motor running now is interesting. I've always been a little bit of a science junkie, but I think we are living and practicing in such a time where the research is giving us so much more now than we've ever had in the past. Even things like the composition of the oral microbiome, the virome that exists in the mouth, what these bacterial species can do to really harm patients. And you might think, well, why is that exciting? Well, it's because once we know what's actually happening, the mechanism, the etiologies of disease, we're seeing so much innovation coming to dentistry on solving some of those challenges, products and services and treatments that we have that we can offer patients. If you would have told me years ago that there would be technology at some point in my career that could actually arrest and possibly even reverse cavities, I would have said you were crazy. But we actually have that. We have practices using that now. So I think, the more we learn about the human body and what's actually happening in the mouth and the link that has to the systemic health of our patients. I just get really excited at the rapid pace of information that we have, but not just that, but also the solutions that people are innovating to help us. Once we identify, hey, we've done our voice perio chart and it's so much faster and easier, that just opens up more time, opportunities to discuss all of these other things, all these innovative solutions that we're seeing. I've been a laser hygienist since the very beginning, but now there's, so many more options that we can offer patients. We've got guided biofilm therapy, we've got desiccation therapy, we've got innovative products out there that are really giving us more than just a Reston to impact the composition of the bacteria in the mouth and really affect the pathogenic bacteria in such a powerful way that as a clinician, I can't help but get excited about all of those things.
Yeah.
It's probably a little bit too much on the science side for most of your listeners, but to me, that's really fascinating. I often hear dentists and hygienists say, it's a terrible time to practice dentistry. I have people ask me if they should be a hygienist or a dentist, and I say, absolutely not. And to me, that's just tragic because I think there's never been a better time to practice dentistry and hygiene because of all the technologies, because of the research and the science and the products that we have that can really help our patients. The whole line in Jerry McQuire, help me, help you, that's what I get excited about. When patients come to see us, they really are asking for and looking for solutions, and they want to have a better dental future than what they've had in the past. And I feel like now more than ever before, we actually have the capabilities to really help our patients in that way. They can have a better future. Just because they've always had a struggle with cavities or gum disease doesn't mean they always will. And so to me, that's exciting to see that we actually have innovative solutions that can really help patients improve their health.
It's crazy to think, Wendy, that over all these years, and for those of you that have been in dentistry and dental hygiene for many, many years, and the things that you had to do when you knew that a patient had a challenge, had a problem, and let's call it like it is. In some cases, you didn't know the answer, right? You did the best that you could, scaling and root planing and periodontal therapy and all that stuff, right? And so it feels like for many, many years, your hands were kind of tied. But to your point, like just hearing you go through all of those new innovations that are coming to the industry, especially just in the prevention side and the microbiome and all that, like if you are a clinician and you at the core love to help patients get healthy, I don't know how you couldn't be excited about all of that. And, I feel like, and this is a great example, that now more than ever, companies that are bringing these technologies either have as a part of their fabric clinicians that are like part of either like the dental officers, or they're a part of those companies. And so they're giving their feedback both from a practical standpoint as well as a scientific standpoint, working together with, capital that in many cases is coming into the industry. So yeah, it really is. If you can't tell everybody, obviously Wendy and I are very excited about where this is going. And, certainly the Alta AI piece is one important piece of the puzzle, like you said, because I think we'll wrap on this. There are a lot of companies out there when you bring any new technology to the space that says this will help you save time. The real question is that what are you going to do with that time? And I think you've kind of filled in those gaps now, right? That's what's exciting about this technology. And more importantly, I think this learning series is we all put our heads together and say, okay, these technologies are helping us save time. Now, what can you all do as clinicians to maximize that time to help patients get healthy? So, final thoughts.
Well, again, time, we could have a whole nother session just on that, right? Because there's a lot of organizations that because of the profitability struggles that we're seeing in dentistry in general, supply costs are up, salary costs are up, especially on the hygiene side. There's so many voices out there that say the only way you can be profitable is to shorten appointments down and have more patients volume flow through your office. And, in my mind, that's taking us backwards rather than forwards. And so what we've proven is that we can maximize the impact that hygienists have. We help hygienists maximize 3 critical roles: preventive therapist, periodontal therapist, patient treatment advocate. And when that happens, we need every minute of time in that appointment time to provide world-class care. And we are seeing, practices come to a realization that shorter appointments are not always better. And there is a way to provide world-class care without compromising the quality of care you provide. So when we talk about time-saving resources and technology, we absolutely help practices understand what to do with that time and how to impact that time. Because like I said, sadly, so many think that the only way to maintain profitability is to shorten those appointments down. And we disagree with that. Like you said, we're going to leverage that time savings into higher levels of patient care, which often translate to higher levels of profitability and help resolve, the hygiene squeeze or the profit squeeze the right way, in a way that everyone can feel good about, doctors, hygienists, and patients. And so again, that's what drives us and motivates us, is that we know there's more than one way to run a successful dental practice, but certainly, in my opinion, we should always be embracing and looking for the ways that elevate patient care.
Awesome. Well, you and I could talk for hours. We're going to end it here, right? And the Alta AI team, I know, is certainly thankful for you and your involvement in this to kind of kick off this learning series. We're excited, everybody, to continue to bring on professionals in the profession that are going to talk about AI. And as you can see from my conversation with Wendy, who knows what direction it's going to go? We are going to talk AI. We are going to talk in a lot of cases some of these newer technologies like Alta AI. But most importantly, it's those of us banding together to move the industry forward. So, Wendy, thank you so much. Best of luck as you continue to do great things. Talk to you soon.
It's always a pleasure. Thanks, John.